process of recognizing and properly identifying the threat is one of the most important elements of emergency response. In the case of CBRN incidents, this is also a very dangerous process for stewards or security officers. To minimize such risk, I'll familiarize you with the rules on how to identify CBRN hazards based on the 5S procedure, and also how to recognize CBRN incident in case of sudden deterioration of the health of people based on the 1-2-3+ procedure. Let's start with the 5S procedure. What is it? Sights, signs, symptoms, smells, sounds. Analyze and evaluate all 5S elements. Their presence may indicate the presence of CBRN agents. Sights. Note the presence of symbols and technical or safety numbers of containers with hazardous materials. Are there any traces of hazardous materials at or near the incident site? Signs. Are there any signs of the possible presence of hazardous materials? Unexplained clouds of vapors or fog. Fog coming out from a backpack. Oily droplets on surfaces or water. Dead or disturbed animals or birds. Withered plants. Unusual objects or equipment at the incident site. Symptoms. Are there victims with unexplained symptoms or signs that may indicate the presence of a hazardous material? Irritation of skin, eyes, respiratory tract, difficulty in breathing, nausea, vomiting, sweating, enlarged pupils or blurred, painful vision, convulsions, malaise or loss of consciousness, unexplained fatal cases. Smells. Are there any unusual smells or reports or complaints of smells that don't fit into the situation? Smell of swimming pool, almonds, mustard, fuel, burning. Sounds. What can you hear? Are there any reports from other people about unusual sounds, for example hissing sound or escaping gas? The sound of glass breaking, fireworks, gunfire or explosions. Sounds coming from the inside of buildings, vehicles, containers or bags. The combination of at least 2 of 5S at the same time, sights, signs, symptoms, smells, sounds, greatly increases the likelihood of the presence of CBRN materials. Always approach any unusual situation with extreme caution. 1-2-3+ procedure. Now, I will familiarize you with the way to act in a situation where there is a sudden health deterioration of one or more people for unknown reasons, according to the 1-2-3+ procedure. Without knowing the circumstances of such an incident, approach the whole situation with great caution. Before you take any action, remember your life and health is the most important. Use all possible personal protective equipment. In the case where one person is affected, initially inform the leader. Initially inform medic. Approach with standard protocol. Check the symptoms. Assess whether this is a CBRN incident using the 5S procedure. If not, provide first aid. If you suspect the presence of a CBRN agent, quickly leave the site heading upwind from the hazard. Report the injured to your supervisor using the then protocol and control the scene. In case where 2 persons are affected, initially inform the leader. Initially inform medic. Approach the injured people with caution. Check the symptoms. Assess whether this is a CBRN incident using the 5S procedure. If not, continue to deal with them as you would with a single injured person and provide first aid. If you suspect the presence of a CBRN agent, then do not approach the injured, and quickly leave the site heading upwind from the hazard. Report the injured to your supervisor using the then protocol and control the scene. In case where 3 or more persons are affected, do not approach the injured. Quickly leave the site heading upwind from the danger. Report the injured to your supervisor using the then protocol and control the scene. For more information about CBRN procedures and recommendations, please visit Safe Stadium website.